Hi, I'm going to speak briefly about the blotting technique. This technique was developed by periodontist Dr. Joseph Phillips in the 1960s. Periodontics is an area of specialty where dentists study the supporting structure of the teeth, the diseases, and any conditions that might affect them. In his research into the structure of teeth and gums, Dr. Phillips established beyond doubt that toothpastes, mouthwash, and flossing was simply not enough. He found that gum disease, tooth decay, tooth loss, cavities, bad breath, and much more could be solved and eliminated using his special blotting technique. These days, there are so many different brushes, toothpastes, mouthwashes, and flosses, yet most people suffer from at least some gum disease, and that's still one of the most common reasons for a visit to the dentist. So can brushing and flossing really be the answer? Using the blotting brush is like having a vacuum cleaner for the gingival crevice, that space between the gums and the teeth. That's where the unseen plaque accumulates, and disclosing solutions to show where plaque is forming won't locate the hidden plaque. Although the blotting brush looks much like a conventional brush, the specially textured bristles draw plaque and debris from the gingival crevice. How to use the brush? Well, not by brushing, not by using a side-to-side motion, and certainly not by using any toothpaste. Dab the bristles against the teeth and the gums, tap them, blot gently up and down. The gums, the teeth, the cheek, and the lips. The reason no toothpaste is used with this technique is it ruins the unpolished bristles, decreasing their cleaning power. And blot at a time of day when you're not rushing off to work or too tired and want to go to bed. Blot when you're reading, you're listening to the radio, or watching television. The technique eventually becomes so effortless, it's not unusual to forget that you're blotting, much like unconsciously picking your teeth with a toothpick. To get his patients used to blotting, Dr. Phillips used to tell them to put the brush into their mouth and use no hands, just chew lightly on the bristles. If you've tried brushing and flossing for years and you're still being recommended for fillings or gum surgery, just try blotting for yourself. You'll feel the difference almost immediately. The condition of your gums will improve, the brush will stop a build-up of plaque, and your breath will get better. You'll also save a fortune at the dentist. There's a smaller version of the blotting brush called the mini blot for children as well as people with sensitive gums. One useful tip, the best mouthwash on this planet is your own saliva. Saliva is vital for your immune system, and blotting stimulates saliva in the mouth. Any of you campers and preppers out there, if you're going on a camping trip or preparing for a disaster, these brushes are essential for your bug-out bag. In the wilderness, there's not always time for brushing your teeth daily, and stocks of toothpaste can be heavy and will run out. Having a stock of these brushes on hand will help keep your breath and gums healthy for months, so it's important when there's no dentist nearby. And here's some genuine feedback from users. I spoke with Dr. Phillips several times before he passed away. My wife and I have been using the blotting brush since 1990. When first-time users feel the benefits, they regularly come back for more brushes. So click on the link below and make sure when you're on the website to look at the tooth chart. This chart shows which of your teeth are connected to which organs, which glands, which joints, and any other relationships they have to the rest of your body. And as I record this, the chart is only in English, but it will soon be in Chinese, French, and Spanish to follow.